rollout, let's bring in our poly panel. We're joined by Liberal MP Dr. Katie Allen, and we're also joined by Labor MP Amanda Rishworth. Thank you both for coming on this morning. Katie Allen, I might see if you've got any clarity on that issue that Fauzia mentioned. Yesterday it was announced that the second Pfizer dose for people in New South Wales would be pushed out to 6 weeks to ensure that more people can get that first dose. Do you know if that means that people with a current appointment booked for a second dose will have to cancel that appointment, or is it for appointments made from here onwards?
I actually don't have the correct response to that, so I wouldn't want to complicate things by confusing people, other than to say that it's really encouraging that people are putting their arms out to get the vaccinated, because that is the only way out of this lockdown. And it's encouraging to see that people see the distinction. We have got lockdown in Sydney, half of Australia are in lockdown. Really, really tough for people. People are angry, they're frustrated. I completely get that. It's very clear now that the best way out of this is to get the vaccination. And I encourage the fact that we're extending out that second dose timing for Pfizer, because it will enable more people to get the Pfizer vaccine as a first dose. But more importantly, AstraZeneca is a wonderful vaccine. There's more than 45 million doses in the UK, and they are now seeing a third wave of 50,000 cases a day. But unlike their second wave, with 1,300 deaths per day on January 3rd in the UK, there are less than 50 deaths in the UK per day. Now, that's just extraordinary for us to think about from a data point of view, that there is now a disconnect between cases and deaths, and that is a great thing. It means the vaccine is suppressing the death rate in the UK, and the only way out of this lockdown or rolling lockdown scenario we have here in Australia is for people to get vaccinated. I really welcome the change we're making. We've had supply issues, but it's time for people to put their arm forward and get the vaccine that's appropriate for them.
That's AstraZeneca. Amanda Rishworth, ATAGI has says that Pfizer is recommended for younger Australians. New South Wales Premier Gladys Berejiklian had asked for additional doses from other states to try to target the younger Australians that are in New South Wales that may be impacted by this particular lockdown. Was it right for her to ask for extra doses from other states, given it is a national emergency?
Well, look, I can understand Gladys Berejiklian needing to get those extra vaccines and feeling the pressure to get more people vaccinated. Of course, I can also understand the other premiers. We are in lockdown here in South Australia. Victoria is still in lockdown. So there is an urgency around the country. And so I can understand premiers who have outbreaks also wanting to get their population vaccinated. I mean, ultimately, unfortunately, there is a lack of supply. And this is the fundamental issue we're grappling with. We are all running around trying to get our hands on the recommended doses. And this really, I really would like to see the Prime Minister do much more in trying to secure more doses faster. This has been a mistake by the federal government, but they need to try and do something now. Otherwise, we will just see premiers really trying to get doses from one another. But ultimately, what we need to get out of this lockdown is the whole country vaccinated. That's the only way out.
Katie Allen, you were speaking about the merits of AstraZeneca just earlier. We heard that also from the New South Wales authorities, from the Prime Minister this week. But the fact remains is that there's still that hesitancy when it comes to that vaccine. And at Sydney Olympic Vaccine Hub this week, there was one day where we had 9,000 Pfizer vaccines delivered, but only 50 people took up the AstraZeneca. So what is the federal government doing, apart from making those appeals at the press conferences? What else is the government doing to drive home that message?
Well, I think there's three aspects. Firstly is the Prime Minister is very clear in his messaging. Secondly, there is a large advertising campaign and marketing campaign that's out there, not only in English, but in all the different other languages that are important for our multicultural community, to make sure that those who are less able to access the information can access the information. And then the next layer is every MP needs to get out there. And I know I've sent out many emails about where to go, what is the information to get from the public health point of view, and then to go and see your GP. But at the end of the day, Australians are looking at that risk benefit ratio for themselves. We know that our virus success put us to the back of the queue for the Pfizer vaccine. That's why we backed in AstraZeneca, because we wanted sovereign capability. We weren't to know that there'd be a 1 in a million side effect risk of clotting factors, clotting problems resulting in unfortunate fatalities, but it is less than 1 in a million. And we know that our risk balance ratio is different because we've been able to suppress the virus, but we're now looking at a different risk balance ratio. And so Australians are seeing that, and they are therefore increasing their uptake. We've seen vaccine hesitancy fall. Those countries that have been most successful in suppressing the virus do have the highest vaccine hesitancy rates. So we know in a global tracking, we're about the second highest vaccine hesitancy. It was as high as 40% of our population was vaccine hesitant. That's now dropped to 30%, which is great. But the facts speak for themselves. When we've got no COVID, people are nervous to take any risk whatsoever. When we're looking at an outbreak, which we are looking at, trying to contain this terrible Delta virus, which many other countries around the world are now facing difficulties with, the risk balance ratio becomes different, and Australians get that message. Or I've heard so many constituents know very detailed information about the risks and the benefits. They know those risks, they know those benefits. And as the situation is changing, as Delta, this terrible Delta variant, is getting out of control of contact tracers, we understand the only effective public health measure at the moment seems to be lockdown, unfortunately. So we're in this difficult position, and the only way out is to increase the coverage of vaccination and for people to get the vaccine that is right for them. It's voluntary, it's free, but it's time for Australians to step up and support this national initiative.
Amanda Rishworth, you know, you mentioned earlier on the problem here is supplies, the supplies of Pfizer in particular. But as Katie Allen just pointed out there, we are swimming in AstraZeneca. It is homemade, and the risk of getting a blood clot is minimal. The Premier has driven in this message. Premier of New South Wales has driven down this message. The Prime Minister has done the same thing. Many other people are doing the same thing, experts including. What else do you think needs to be done in terms of messaging out to the public that AstraZeneca is actually a good vaccine?
Well, you know, I think it is incumbent on the government to have a good public health campaign. We have yet to see a good public health campaign from the government, but I'm not going to, you know, try and make any comments about what individual vaccines people should take. That is a matter for their doctor. But I would say that even in the over 70s group that is eligible for AstraZeneca, there's only a 30% vaccination rate. There is clearly, and that is not all due to hesitancy, there is clearly also a distribution issue when we've got only 25% of our aged care workers and our disability care workers vaccinated, that while supply is a serious issue, there's also a serious issue of distribution when we've got plenty of AstraZeneca vaccine and only 30% of the over 70s are fully vaccinated. So I think there is a significant issue here on distribution, and I think the government, and particularly the federal government, has got to take more responsibility in how they actually get distribution right, as well, of course, as getting supply right, as well, of course, as getting a public health messaging here. This has been a botched rollout, and quite frankly, we need the Prime Minister to show some leadership here.
Katie Allen, a quick response there, because I've got another question for you.
Well, in the over 70, more than 75% have had their first dose, and that dose has some protection. It's not perfect protection, but it is some protection. And it's important that we encourage people, once they've had their first dose, to go and get their second dose. There is a 12-week lag with AstraZeneca. One of the benefits about more Pfizer becoming available, and we've got 1 million doses a week coming on board, is that there's only 3 weeks between that and the second dose for those outside of New South Wales. But the important thing is we've got 1 million Pfizer vaccines in this country per week. We've got 1 million AstraZeneca doses per week. We could double the speed that this vaccine rollout happened if people were willing to take up AstraZeneca, as 45 million people in the UK have done.
Katie Allen, I wanted to ask you about the financial support, because there is some financial support from the federal government, but it's not coming close for many people at making up what they usually would be on from their work. And we know how important it is to provide that financial support as an incentive for people to do the right thing and to stay at home. Will the government, particularly in areas where we're seeing these lockdowns drag on, increase that financial support?
Look, I understand how difficult this is for people. They're losing their livelihoods. They're worried about their jobs. This is an incredibly difficult time for everybody who's in lockdown. In fact, the whole country is looking to this as a real crisis, really. And so I do understand that. But for those who are under 20 hours a week, it's $375 a week. Between 8 hours and 20 hours, they get a flat rate of $375 a week. And those who are on more than 20 hours will get $600 a week. And that is the same level as JobKeeper was at the end of this year. But more than that, there are many different sorts of payments available for people depending on their particular circumstances. So I really encourage people who are listening, go to your local federal MP. I'm taking a lot of calls myself and emails. Very busy time for local MPs, or go to Service Australia. There are lots of different opportunities, not just for income protection support, but other forms of support, and also providing 50-50 support with the states for businesses and their support. So there are lots of different programs out there, and it's important that people can navigate the ones that are appropriate for them.
Amanda Rishworth, it has been reported that people on welfare aren't able to access these disaster payments. These are the same people who've lost their jobs, can't pay their rent and put food on the table. Is it time to bump up JobSeeker?
Well, look, first of all, I'd say that it's been very unfortunate that those receiving any social security payments, including parenting payments and other such payments, have been excluded from this disaster payment. And of course, this, in some cases, this disaster payment actually was more than, or is more than, their payments they were getting from the government. So this is really difficult, that it hasn't been a situation where automatically you get the higher level of payment, but also a lot of people are losing now connection with their workplace because JobKeeper was scrapped. So there are many different problems here that mean that a lot of people will feel they have to go to work. They will feel that they've got no choice to go to work because either the payments are not enough or there is no long-term security for them. So this is quite concerning, and I think it's incumbent on the government, considering they should have expected these lockdowns. It was in the budget that there would be rolling monthly lockdowns as an expectation, that they really should have it clear about how best to support people and not just immediately exclude people because they're already getting perhaps a very small payment from the government, which means it's not enough to actually keep food on the table and pay their rent.
On that point, we're going to have to leave it there, but thank you so much to both of you for joining us on Weekend Breakfast. Katie Allen there in Melbourne, and we've got Amanda Rishworth there in Adelaide, both in lockdown. We wish you the best in lockdown.
Thank you.
It's time.